In today's episode of the 340 Banter podcast, we're joined by Rhiannon Klein from Community Voices of 340B, or CV340B. We'll learn about her history and background in advocacy, as well as discuss practical approaches to effective advocacy. So Rhiannon, I know a lot of the advocacy work you do nowadays is with CV340B, but I'd love if we could kind of take a step back from that before we delve into CV340B and just talk about the world of advocacy in general and your journey through it.
Yeah, that's a great question. So I started doing advocacy in high school. I was really passionate about HIV, preventable diseases in sub-Saharan Africa. And so I remember there was
that is unique for a high schooler.
I tell you what, yeah. There was a World AIDS Day where I was like, I'm going to do something, and I printed out a bunch of flyers that had facts about sub-Saharan Africa and HIV/AIDS and all of that, and I just like handed them out in my high school, and people were like, "Wow, I was really popular." I don't know if you can tell. And that was kind of my first advocacy thing that I did by myself. And then I went to college. I did macro social work, which is kind of a public policy version of social work with an emphasis on sub-Saharan Africa, and started working with...
Love that you were able to pull that through
it was
college
great
as well.
Yeah, even, I mean, in an undergrad, it was really rare. I was accepted at the One Campaign, which is it's a campaign, advocacy campaign that Bono started from U2.
Oh, I've heard of it. Yeah.
Yeah. And they work with the RED project. So a lot of times you'll see RED, phone cases and stuff like that, or Project RED. I don't remember what it's called.
Is that the logo with like the parentheses? In red? Okay.
Yeah, exactly. And I was their government relations intern for one semester. It was a lot of fun, and I learned so much. And it happened right as a turnover in Congress happened. So I applied to every open position in Congress, every open staff position. I even applied to be an intern, everything. And nobody was hiring because, there's a huge turnover. Staffers had been let go from one office, and they were finding positions in other offices.
And they had experience.
They had experience. Yeah. And I had nothing. I had some, but not in Congress. And I was like, oh, okay. So I moved back home, and then got into my first job right out of college was doing HIV/AIDS advocacy here in the States. And it was a lot of fun. And from there, 340B, and that's how I got into CV.
Generally, I don't hear of anyone that starts advocacy in high school other than me. So
Yeah.
It's kind of cool that somebody else has done that, because that's really how I got involved in it. And I just really took a love to it. And I actually considered going into government affairs work in some fashion before I decided pharmacy school, and never thought I'd come back to it. But
right.
These paths happen. You end up in just finding the right way back to what you love to do.
Yeah, I think with my personality and just who I am just naturally, I think about it a lot, where there was just really no other path that I could have taken. This is just it for me.
This was the journey for you,
this
no
was
matter
it.
what.
I'm outspoken. I like to light things on fire. That's me.
Well, talk to us a little bit about CV340B. I know recently you went from being an employee or a company of one to a company of two.
Woo!
Woohoo! But talk to us a little bit about kind of the origin of CV340B and how you've been able to grow that really over the last few years.
Yeah, CV340B, so Community Voices for 340B, we started about 10 years ago, and it was a group of 340B stakeholders that got together and were like, what's missing is the patient voice. We have all of these organizations out there that are stakeholder specific, right? So we have, 340B Health, that's a hospital specific. We have NAC, that's a community health care center specific. And then we have Ryan White clinics for 340B that is Ryan White specific. But we didn't have anything that was an overarching together for 340B patient-focused, community-focused organization. And so we stepped into that space and said, look, this is a y'all come. Everybody come. We're going to do advocacy together because ultimately that's what's going to save the day. That's what's going to move the needle. And so we started with that idea. We started before COVID, and we did these in-person advocacy events. And we did one in Texas and Michigan, and we got people together in the same room. Oh my gosh. And then COVID happened. And everything just went to a grinding halt.
Yep.
But it turned out to be one of the better things for CV340B because we moved everything online to Zoom. And so now we've got these 5 flourishing regional advocacy groups that happen once a month. And each of them, have 100, 200 people that are signed up for them. And people can come in and out. And so every month they're getting an update for 340B from experts in the field. They're getting what's going on in their region. And they're getting to talk about advocacy and how they can work together as a united stakeholder group to really defend the program and resource share. That's a huge part of what CB340B is doing is like, I'm doing this. What are you doing?
That's one of my favorite parts of being on those calls is when folks from, health centers, hospitals, what have you, out in the community say, this is what we've been running into lately. What do you suggest, or what are other people doing to navigate this? And then getting, real-time, realistic solutions or things to try at least to help navigate the waters.
Yeah, I agree. The advocates in the 340B space are well educated. I mean, they know what they're doing, and they're so willing to help each other because this is a complicated program to manage. It's not a complicated program to explain, but it's a complicated program to manage.
Yeah.
And so not being siloed and not feeling like you're alone, it has been kind of a beautiful tertiary effect of these advocacy
Yeah, that's
groups.
one thing I love about 340B is that we all kind of chip in. We share documents. I mean, the health center community, they're commonly sharing policies and procedures and different things, but we really see a lot of value from the calls. And in fact, something you may not know is if we get double booked, we're all messaging internally to make sure somebody else can be on the CB calls.
I love that.
Because we do see a value with it. And we've got health centers we work with all over the country. And so we can hear what's happening in that specific region.
Yeah. And the beauty about these calls is that all of the successful things that we've done in advocacy at CV340B, the ideas from those calls were the genesis of those things. Like, so, the Defend 340B March, one of the people on our Southeastern call he was like, hey, why don't we do a march? And I was like, hey, let's do a march. That's a great idea. And so it really has become a really collaborative organization. You're not going to be successful if you're not collaborative. It's just not going to happen, right? Like, so having that as a real core feature of advocacy has been really rewarding as well.
I know that for folks who've not historically been involved in advocacy, it can feel intimidating or unwieldy or unapproachable even. Let's talk through some of kind of the practical approaches to advocacy, specifically where they've worked really well for CV340B, but can have more of a general approach. I think that one of the things that stands out to me that CV340B does really well is the use of social media in advocacy work and distilling what can be a really complicated topic, because 340B can be really complicated, and distilling it down into a simple, digestible message that hits home and having that, spread easily through social media.
Yeah, one of the things that we've really focused on in the last 5 years is dialing up the social media presence of the 340B program in general. Since 2020, when contract pharmacy restrictions started coming out, it's been an onslaught of anti-340B messaging coming from the other side, from pharma. And a lot of it has been misinformation where, you kind of see these articles that are like 340B is being abused and it's buying chandeliers and it's doing water features. And I'm like, really? Have you walked into a community health center recently? And we were just so overwhelmed with the idea of, pharma's buying full page ads in the New York Times, which is, $60, $70, $100,000. We're a grassroots organization. 340B is, by its very nature, an organization or a stakeholder group of nonprofits. We don't have that kind of money.
Yep.
And so we look to social media. How can we do this effectively? And how can advocates engage on social media in an organic way and then also in a paid way that will raise the level of education around the 340B program and address some of that misinformation. And we found that social media is extremely affordable. So even if you're doing paid, social media, you can spend, $1,000 and you can get 250,000 people in front of your ad. That's huge.
Yeah.
That's a huge thing for a low cost. And so it became a really effective way for us to bring the community together, for advocates to have their own voice and tell their own stories. We came up with this Together for 340B campaign.
It's also where, a lot of people get their news these days. Fewer and fewer people are going through print media and more going, getting their information from social media, the internet and things. So kind of meeting people where they are.
And what we've discovered is 340B is a complicated program that's super simple to explain to people. It's not actually that hard. We in the community get bogged down by all of the ins and outs and the intricacies and the day-to-day of the 340B program. But really, it's a program.
And that's not what the community needs to know.
No,
they need the basics.
No, exactly.
Yeah.
Like, how does this affect them? You know?
So what's your elevator speech or your elevator definition of the 340B program? Yeah, right now.
Aw, snap. I usually say 340B is a program. It's a discount given by pharmaceutical manufacturers to nonprofit healthcare providers that underwrites the cost of those healthcare providers providing services like transportation, food assistance, copay assistance, and things like that. It makes healthcare affordable for those who can't afford it. It costs taxpayer nothing. And pharma doesn't want to pay it anymore because, pharma's a shareholder run company and they're interested in profits and not patients.
Very simple and succinct.
Yeah.
Super simple, right?
One of the things I've loved about your guys' social media campaigns is you're coming in and helping these smaller covered entities that may not even have a social media or marketing person.
Yeah.
I know at my health center, our social media team was made of members of management that volunteered to do it in addition to their job. So I was social media coordinator along with a office manager in a primary care office and an office manager in one of our behavioral health offices. So I'm doing that in addition to being a director of pharmacy. So it's just one of those things you add on. You don't have the resources. So by having CV come in and help, it's been really successful in being able to frame a more professional, polished social media content.
Yeah, I think so. And our sponsors that have come in to do the Together for 340B campaign, one of the things that they say that they really like is that 100% of the sponsorship goes towards making these ads and then placing the ads for them. And then they get all the information, the data, the audience, all of that after the ad is complete. And then they have kind of this evergreen content that they can use. They can share and use in multiple different ways. And they can share with their board members and their community. And it's really effective. It's so customizable too. Whatever you want to say about the 340B program, you can customize it to that. So we worked with Damien in Indiana, and they were like, we want to be a little more edgy. Let's do something exciting. And so we did Pharma wants to raise your taxes during tax season. It was phenomenal.
That'll unite all people.
And it really did. I mean, people are so scared that you're going to get negative comments, and oh my goodness, and not one negative. It was during election season. And so it was, go Trump or go Biden. But then the second line was always drug prices are too high. Doesn't matter what side of the aisle you are.
Parties.
Drug pricing is too high. I don't know of any other subject that would unite the people of America like drug pricing is too high. Now, if we take that one step further, drug pricing is too high. Who sets drug prices? Pharma.
Yeah.
Right? Like, we have to be very succinct about saying this is where the blame lays. So yeah, it's been great. And then, just producing content, and this is something that Grace, our new advocacy associate, is going to be working on, producing infographics and content and things like that we'll share on cv340b.org, that we share on our socials, that health centers that don't have anybody that is a specific marketing person like your former health center, they can just grab, share, use whatever they need to share the message.
So around sharing the message, I know that a lot of the work that you do is around what that message is, and how do you recommend that people kind of effectively settle on or communicate that message instead of kind of going for 100 different points and not being able to make one argument clearly or kind of leave one lasting sentiment?
Yeah, we have on our website Touchstones and Truths, where we've really distilled down the 340B message into a handful of touchstones. We talk about things like the 340B program's intention. So if you always start with what was the intention of the 340B program, you've got a great foundation to go anywhere you want.
Exactly.
And so we always try and start there. And then we talk about the work that covered entities do to maintain their 340B program as being open and transparent, because it is, the covered entity community works extremely hard to audit internally, audit externally, share those audits with the public. And so the idea that it is not transparent and the idea that we are hiding something is just not accurate.
Yeah.
So I think that's the second point. And then the third point is this benefits patients. How does it benefit patients? How does the 340B program support services at your covered entity that would not otherwise have any support? We've talked a lot about the COVID-19 vaccine clinics. The vaccine was free, but the time for providers to give the vaccine, to organize the drive-through vaccines, to follow up with patients after vaccines.
I spent 3 months doing nothing but vaccines.
Yeah.
So that's you've
time.
got to consider that salary
Right.
that I wasn't able to do my normal job.
Yeah.
That's all I did was vaccines.
Yeah. So who paid for that?
Yeah.
Who paid for those hours that, providers are not cheap. And that's where the 340B came in. And I think that's not talked about enough, is that at a time where pharmaceutical manufacturers were restricting providers' access to the program, those providers were having to use 340B savings to be able to literally save the United States and the people that needed the vaccines.
And one of the things I love to talk about, and Chelsea has commented on before, is I think it's important to frame your message. So you can highlight different benefits of the program depending on who you're talking to. So if you're talking to somebody that is really focused on equitable health treatment, then you can highlight the fact that we're with 340B, we're able to provide these extra services that wouldn't normally be available in that area. But if you're talking to somebody that's really concerned, more conservative and concerned about taxpayer dollars, that this is decreasing the reliance on more expensive services like ER care for our patients, and we're able to keep them out of the ER, which saves Medicaid, Medicare dollars.
Or the existence of the 340B program saves taxpayer dollars because there's no federal funds behind the program. And without it, we would have these holes in our healthcare system that we would still need to fill and be able to provide for. And that would have to come out of taxpayer dollars.
I mean, that's back to pharma wants to raise your taxes. If pharma gets its way, your state taxes, your federal taxes even are going to go up because there will be holes in the public healthcare safety net. I always like to tell people that don't try and do it on the fly. Building your story on the fly. Yeah. Have a base version of your story, and tell it as often as you can to everybody that you know, and then once you've got that down, do those iterations.
Start with your family.
Yeah, start with your family.
Because that is probably where we all struggle, is explaining 340B to people that have no clue.
Yeah.
So I think that was the best way for me to get my message across, is to just start with them and explain it to them and your friends, your church community, whoever you're around. If you can explain it to them, then it's going to help when you're explaining it to legislators, because they have so much to focus on. They don't know 340B like we do.
Right.
So you need to be able to explain it to them like you would do any other community member.
Yeah, and that's a good point, actually. Policymakers, all of your policymakers, staff comes in and out. We've just got a new Congress, and so you're going to have new staffers that you're going to have to raise their education level. They are being pulled in 17 bazillion different directions right now,
especially
even
these days.
Even just if you're a healthcare aide.
Yep, even if you're just your healthcare LA is unable to focus on the 340B program exclusively. They have it's a moving target for them. And so, yeah, make sure that you're saying this is 340B and that you're saying it over and over and over again. And I've said this a couple of times, is make this the outlet for the most annoying parts of your personality. Just continuously say the same thing over and over again until you're annoyed with yourself, and then continue to do that even more, because I guarantee you it's not enough.
And we're at a totally different situation now than we were before COVID, because you can do virtual meetings with legislators.
They prefer virtual meetings. They're like, don't make me come out of my little cubby.
Yeah. They're open to them. But then you can also, if you're wanting to talk to a congressman, you don't have to go to Washington. You can meet virtually, or you can go to their local office. They all have offices in the district.
Yeah.
Where you can meet with an aide there. And just because you're not meeting with the actual legislator isn't a bad thing.
No, it's better.
The aide is the one that drives what's going to happen in the office and the priorities, and they help guide the legislator. So that's a good thing.
Yeah, and I will say, covered entities, there are some that are concerned, they're a 501c3, they can't step on any toes, but if you're educating your policymaker on the 340B program, you are not violating any part of your 501c3. You can't say things like bill numbers and advocate for specific bills that are currently active. But you can definitely go in and say, hey, this is my health center. This is what 340B does. This is how many patients we serve. That's hugely helpful. And right now, what we're hearing from Capitol Hill is explain the harm in great detail. Not what could happen, what is happening right now.
What has happened.
What has happened right now because of whether it's contract pharmacy restrictions or, whatever it is that's happening right now in your health center or your hospital, so that those staffers then can go back to their boss and say, look, this is what's happening, and they can reach out to you again if they need more information.
I would go as far as even recommending talking to press about it.
Yeah.
If you're in covered entity leadership, My health center had to lay off 4% of the workforce this past year. And there was a news article about it, and it eventually ended up in 340B report and different venues like that. But a lot of times you want to keep the dirty laundry inside, but it's important for legislators to see that this is having a real impact in their communities with their constituents. And if one of the largest employers in the area is starting to lay off people, that's going to be a problem for their constituents. So.
Yeah, no one wants to be that organization that's having to lay people off. Nobody wants that. But in order for you to be able to sustainably advocate for the continuation of your covered entity, you got to get that news out there.
Yeah,
you got to say,
let no good crisis go to waste. Like, this is what happened. Yeah. You have this story. Like you can't change the fact that this is the impact that it had on the organization. However, you can tell your story so that it's clear that this is the negative impact that these restrictions are having on the community.
Yeah, and it's don't underestimate the power of your local news station. A lot of times when thinking about getting the word out, it's like, oh, we need to go to, Healthline and Politico or whatever. No. Like, start with your local news agency. Make sure that you have those relationships with the local paper and the local TV news, and tell them what's going on, because it affects your community. And then you have an avenue to even expand on that story more. So you can say, look, we had to lay off X number of people, but here's the 340B program, and here's what it's doing for our community, and here's why it's important. And connecting those two things will give you the overarching, positive effect.
Yeah. I think back to you saying, take the most annoying parts of you and let this be the outlet for them.
Yeah.
The first thing I thought of was learning a new someone's name for the first time. I think it's you're supposed to, you got to hear it at least 3 times for it to stick, and it's good to say it back. And I'm thinking that's just someone's name. And I will tell you, embarrassingly, for whatever reason, J names for me, I could say the name or hear the name 30 times and I will still forget it. There's a black hole for J names in my brain. I'm sorry if you have a J name and I've forgotten it at some point in time. But that's with something simple like someone's name and communicating, just what the 340B program is, what the impact of it is, and what, the harm is by pulling that back. Those are things that need to be communicated repeatedly and in different ways to actually stick and sink in with these people that will make the decisions ultimately.
And it's more for state, but I think it's true of federal as well on a different scale. But we've had, I work with the Ohio Pharmacists Association very closely, previously leadership there. And we had a state legislator tell us that if 5 people called his office on an issue, he knew it was something he needed to move on because it was a big issue. So as few as 5 people can make a difference. It's going to be on a different level at the federal level.
It is, yeah.
But it's still a small number. So you can really make a difference just by having, if every covered entity called their state rep or their federal congressman and their senator, they could make a huge difference. And I think that's where we have a lot to improve on, is just the volume, getting everyone involved. But the more of us that get involved, the bigger impact we can make.
Yeah. And don't be intimidated by calling your member of Congress. You're going to get the front desk person who is normally an intern, who's about 19 years old, extremely smart 19-year-old. But you're going to just be talking to a 19-year-old, and they're going to take down all your information. They're going to hear what your message is, and then they're going to hang up with you. And it's not a big deal. It's really not. So yeah, do
and
it.
It's okay to utilize, and if you do meet with a legislative aide or the actual legislator, it's okay not to know the answer too.
Yes.
So have in the back of your mind that a resource, somebody that you can reach out to ask questions. Maybe that's the PCA, your state hospital association, someone like CV340B, I'm sure could help with some of those answers. But make sure if you say, I don't know, I'll get back with you, that you do follow up, because that makes a big difference. But not knowing, I never want somebody not to talk to a legislator because they are fearful that they won't know every answer, because none of us know every answer.
Nobody knows. I always say if anybody tells you they know everything about the 340B program and their name is not Bill Von Osen, then they're lying to you.
Yes. Yes. Well, I think maybe a good place to end today is just kind of words of wisdom to folks that might be, trying to take some of these more practical approaches and integrate them into their, daily lives to be better advocates for the program that means so much to their community. Kind of last thoughts there on what you want to share.
Get started. Just start somewhere. Whatever entry point feels the most comfortable for you, start there. And then you'll build on that, build the relationships, and get used to what advocacy feels like. Just get started wherever.
Thanks so much.
Yeah,
Rhiannon.
thank you for being with us.
Thank you so much for having me.